Greetings, everyone. I'm Whitney Ortiz, host of the Whole Health series. I am thrilled that Michelle Troseth and Tracy Christofferson, the co founders of Missing Logic, are sharing here their wisdom and guidance on how we can move from burnout to balance, and if we should even consider the word balance as a goal to have. Michelle and Tracy's professional origins are within the healthcare industry. Michelle is a nurse and Tracy as a respiratory therapist. Both have served as consultants as well for large hospitals and other healthcare organizations and systems around the US. After experiencing significant burnout themselves and seeing many of their colleagues going through it as well, they pivoted from their jobs in 2017, joined forces, and launched Missing Logic. Thank you both so much for being here.
Thank you, Whitney.
Yeah, thanks for having us.
Yes.
Well, Tracy, can you please start us off by describing some of the core principles and understandings that are at the foundation of Missing Logic? Like, why does it exist, and how does it take the particular angle that it does?
Sure, I'd be happy to. Well, really the reason we exist is we like to say we're here to transform healthcare one leader at a time. And what we're here to do is to really help them live thriving, balanced, and resilient lives. And one of the things we admire most about leaders is they're excellent problem solvers. And one of the things that we learned early on in our careers is that not every challenge that we face is actually a problem that can be solved. And so some challenges that we face are actually polarities. And polarities are interdependent pairs of values or perspectives, points of view. They can appear to be opposite, but they're actually interdependent and they need each other, or you won't achieve a greater purpose, without both. And so, one of the things that, we realize in all the work that we've done is very few leaders have this competency, and it's essential. It's an essential competence for any leader. It doesn't even really matter what field you're in, what industry you work in. It's an essential competency. And so, and it is the missing logic in healthcare, thus the name of our business. And so we've kind of dedicated the rest of our careers to helping leaders develop this polarity intelligence competence. And we work with them in a variety of different ways. But one of the things that we leverage is our framework. It's called the Dynamic Balance Effect Framework. And we leverage that framework to help leaders begin to see the personal polarities that they face every day that impact their ability to thrive and be resilient. And a cornerstone in that framework is polarity intelligence. And so we teach them that, and they learn to look at things like balancing their professional and their personal life, balancing taking care of themselves and taking care of others. And it's kind of their first step into really embracing and developing that competency. And we really believe that taking care of others is in the DNA of leaders. I swear, they just give it up, right? They give it all up
Especially
to
women
take,
leaders, right? Out there.
especially women, exactly, right? And so once they understand that taking care of themselves and taking care of others is really an interdependent pair, that you have to do both in order to thrive and be resilient and live your very best life, then they kind of get clued in, right? That this isn't selfish. It's not what you might say, kind of like a nice to do kind of thing. It's essential in our lives. And it really is their ticket to thriving.
I couldn't agree with you more. So well said. Thank you. I just put lots of exclamation points around all of
Yeah.
that. And Michelle, if I can transition to you, through your experience with Missing Logic and in your prior work, what have you found to be the number one barrier that leaders have a hard time breaking through in order to really prioritize their self-care and get to that work-life balance, if there is such a thing? And I'd
Yeah.
love to hear your
We'll talk more
perspectives
about
on
that.
that.
Well, it's such a great question, Whitney. Thank you. And I think that the number one barrier is how they look at it, how they look at caring for themselves and caring for others. And many of them look at it as a problem to solve. And they're looking at it through the wrong lens, and and the wrong logic. So that's really what we help bring forward. And often they look at, caring for themselves as a problem to solve. And so with that either or approach, it's almost like they're setting themselves up from failure from the get-go, and they're only seeing half the picture. And so what happens is, then they start neglecting themselves, and pretty soon they're just, pouring from that empty cup. They suck themselves dry, and then they're burned out, and they are feeling conflicted about their work and what they feel their purpose is to bring work to the world, and having a family life and having a personal life. So it really causes a lot of inner turmoil for leaders. And for many, a leader, how they define and think about balance is really part of that barrier. And so it's almost set up in the word balance. It's really easy for them people to think, well, then it has to be an equal proposition, 50-50. And we know that's really not the case. That's not how it works. And another thing that has happened over time is people say, well, there's no such thing as work-life balance. We need to call it work-life integration. That's what it is. And Tracy and I like to say, wow, that's just visualize mashing your personal life and your professional life all up into one ball. We know that's not the answer either, and it's not sustainable. So it's really, again, the number one barrier, I think, is stepping back and say, how am I even looking at this? Am I looking at it as a problem, or is there something more to this? So what we help them understand is the tension, that it is a tension that we all feel between our personal life and our professional life. It's normal, it's natural, and it'll always be present. It's never going to go away. Like, you want that tension to go away, but it's never. But if you learn about it,
Mhm.
and you learn how to really move with it, that is what makes a difference. And that goes back to the polarity intelligence pillar that Tracy was referring to, because it provides the foundation and the understanding of these natural tensions, and how it really demands to be managed or leveraged, and not quote unquote, fixed. So shifting their perspective from the 50-50 balance and having a different perspective than just integrating everything in our lives, that is the key to overcoming the barriers and helping them to manage and leverage both their professional and their personal lives rather than alleviating it. And it really puts them on the path to achieve true work-life balance.
Oh, it's beautiful. And really to see them like coming up on top of it all to be able to manage it from above rather than being within. And
Yeah.
so you give a really great framework. And as you say, this perspective, this mindset that's so needed to be able to recognize that, yes, we are each unique and there is
Yeah.
no one size fits all approach to self-care, but yet it is so important. So Tracy, if I may transition to you, again, what do you see as like key guidance that you found to be really helpful that's in line with your polarity intelligence model when you're working with and for leaders?
Yeah, sure. So I think the first thing is write it down.
Mhm.
You have to have a clearly written, um, definitive action strategy. And, we kind of try to balance these things and manage them on the fly. As the tension rises, we take action, but you really need a strategic action plan, and it needs to be written. And we actually have a self study program, Caring for Others Without Neglecting You. And in that program, we teach people how to clearly define what it is they want in the essence of that balance between taking care of themselves and others, and what are the action steps that they need to take to get those outcomes, because you have to have both, right? So second is know the action steps and take them simultaneously. You need to strengthen both and maintain both and keep it strong in order to get to that place of balance and living your best life, right? And having balance across, caring for others and yourself. So that's another essential element, is take those actions simultaneously. And the third is have an early warning system, because you're going to mess up. You're going to over focus on one and neglect the other. It happens. And you don't want to experience the negative consequences that result from that. So when you have an early warning system, early on, what are those little nudges that you're getting, right? What are the little voices telling you that, oh, I'm not giving enough attention to myself, right? I really need to have a little bit of alone time, right? We hear the voices, or people will say, wow, you look really tired. You get kind of cues from your world. And the same, when you're caring for others, right? If you're not doing enough there, you're going to hear some voices, you're going to have some emotions, you're going to feel some things. And those are our early warning systems. So just writing them down, being clear on what they are, because what you want to do is course correct as quickly as possible so that you don't experience those negative. So those are the three key things.
Yeah, love that. And I would say, as you're alluding to, is really knowing yourself, that self-awareness being so key. Because for some people, it will show up in a physical presence, right? Like a tight
Yeah.
back or
Yeah.
a disrupted stomach. And for others, it will definitely show as like being overtired or clearly drained, right? And to be very aware of others and the way that they'll receive that information. If you would like to give them the kind of permission, comforting care, saying, what, do you need a moment? Or however it is
Yes.
appropriate within the work situation or the home situation. Could you elaborate a little bit more on that and some more specifics with the leaders with whom you've been working and supporting?
Yeah, sure. So there are some individuals, as an example, when you establish your action strategies, right? It can be, if I'm looking at taking care of myself, I have a morning routine. Many of the people we work with, they create a morning routine, helps them get grounded and centered in who they are and what's important to them, right? It may be too just scheduling alone time. Sometimes we just need the noise to go away, right? And or if for some it might be exercise. So it can be different for each person. It really just depends. Now, when it comes to caring for others, that can be in the work environment, right? That can be huddles with your team, one-on-one time with your team can look different. From a family perspective, right? It can be dates, right, with your spouse, your children, calls to your family every week, whatever that might look like. But it's really being intentional, scheduling it in, and really looking at it at the beginning of every week. What am I doing this week to make sure I'm caring for myself? What am I doing this week to care for others? And just taking it into consideration the context of your life in that moment. And this week, what does this look like for me? Does that help?
Definitely. And Michelle, if you have anything to add, because this really works so well, especially for those who really like to do lists and action plans and strategies and really looking at your life as a whole and how you can look at your own well-being as a whole. And so in your planning out or your considerations of everything that might influence you, it's
Yeah.
got to be from this whole, as I like to think about, this whole health
Yes.
perspective.
It's the
So
both
Exactly.
and.
more on
The
that,
both
you'd like
and.
to
Yeah,
clarify.
the both. The only other thing I would add to what Tracy said is it's really helpful to have an accountability partner. So Tracy and I each have our own self other blueprint, and we check in with each other. And how's it going? And how, because we work together, how can we support each other? So you might want to think about doing that with your team. My husband and I have church and check-in every Sunday. It's like, because it's the people around you, that it's not only you, but that the others in your life can help you keep balanced as well. And sometimes it's Tracy that says to me, hey, you're looking a little tired. Do we need to, do something different this week? Or I'll say something to her, so because we just we value it so much, and we really honor the dynamic balance that does need to take place. So that's the other thing that I would add.
Oh, that's wonderful. And to have such a caring partnership through work, I think it's really a beautiful and special and awesome thing to fertilize, to grow, and where women are right now doing even more and more open collaboration and really looking to connect, as this time has shown us the importance of connecting, whether it's virtually or now increasingly in person. And so really inviting that kind of genuine core care between others in your life and really reaching out in that caring way and welcoming it as well and being very open to
Mhm.
receive. So, how can people connect with you and follow your work and learn more about the approaches that you take?
Well, would be probably the best place is our website, missinglogic.com. It's all one word. And we would really like your listeners to take advantage. We have a free perspective paper right on the front page of our website called The Three Biggest Mistakes Healthcare Leaders Make When Trying to Achieve Work-Life Balance. And to Tracy's point, you don't have to be in healthcare. These are universal principles. So if anyone wants to read more, go grab that resource. And then we're also on social media. All of our social media handles are Missing Logic LLC, and we're on LinkedIn, and we're on Facebook, and we're also on Twitter. So those are great ways to get a hold of us. And then we also have a podcast, Healthcare's Missing Logic podcast. And if you tune in, we have on occasion shared tips on self-care. So you might catch some great episodes there.
That's wonderful. Thank you all for sharing. And I'm so glad to have this collaboration to share with our community. We really appreciate you. Thank you for all the work that you're doing.
Thank you.
Thank you, Whitney.